Hi Beck, I'm just sending you a video message today just to give you a little bit of indication on patient complaint procedures. As you know, we are an accredited general practice under the Royal Australian College of General Practice Standards, and that means that we are obliged to be compliant to their standards that they set. There is a formal step-by-step process when you do a patient complaint, and I really just wanted to go over that with you today, not in full, just to give you some sort of indications. It really is a good idea for you to familiarise yourself with the file that's going to be in the admin office, which is labelled patient complaints. Inside the file there will be a copy of the procedure, the policy for patient complaints, which you can have a look through, and it gives you step by step things that you have to cover. There'll also be blank copies of the forms that have to be completed as part of the patient complaint process. There's two forms that you would be required to fill in. One of them would be the patient complaint form, which will be in the file, and also acknowledgement of complaint letter. Now, really, the acknowledgement of complaint letter really is more important it will be sent out by the practice manager, but there will be circumstances in the fact that you are a subsidiary surgery and with a lot less personnel that you may end up having to complete the complaint form. So it's really important that you maybe really look at the file properly. The complaint form, I will firstly, if a patient approaches you and wants to make a formal complaint, make sure you take them somewhere away from this sort of main reception area, with a bit more privacy. They may be upset, they may be angry, it may be sort of a good idea to get them away from the main area where all the other patients are sitting. The form is self-explanatory really. It just has to put the staff member has to sort of write down who they are and who's taking the complaint. And then really how was the complaint made. It's all very self-explanatory, the date and the time. One key thing that you really need to keep in mind is just to reiterate quite a few times so you understand the exact content of the complaint. It's really important in order to be able to sort of write that down. Once you have taken those details, if you could sort of talk to the patient, tell them that we have acknowledged that they've made a complaint and there is a proper process that we will be following. Ask them to, and tell them that the practice manager will be writing them a letter just to acknowledge that. Once you've done the form, pass it on to your practice manager. Have a look again at the procedures and just make sure that if there's any bits that you've got to complete once you've actually done the document. And then basically it then gets handed over to the next step, which will be where the practice manager then looks into the complaint. If it's a specific doctor, what's the reason? It may be unhappy with what they've prescribed, communication. There's all sorts of things that can come up. Really, what we're trying to do is everybody come away with a good outcome, the patient and the practice really, and handle it all in-house. So if you've got any queries on the complaint procedure, you can always contact me anytime. But as I say, have a little look through, try and familiarise yourself, and hopefully it'll all go smoothly. Thank you.